Clonidine tablet, uses, dosage instructions, and side effects. Clonidine has been a staple in medical treatment for decades, offering a multifaceted approach to managing various health conditions. Its versatility and efficacy have made it a valuable asset in the medical community. By targeting specific receptors in the brain, Clonidine helps regulate blood pressure, attention, and pain perception. This medication has undergone extensive research, and its applications continue to expand. With careful medical oversight, Clonidine can be a highly effective treatment option. What is Clonidine? Clonidine is a prescription medication that helps treat conditions like high blood pressure, ADHD, and certain pain disorders. It's classified as a central alpha agonist, which means it works on specific brain receptors to produce a therapeutic effect. By stimulating these receptors, Clonidine relaxes blood vessels, reduces blood pressure, and affects certain brain chemicals that contribute to ADHD symptoms or pain perception. This medication is available in various forms, including tablets, patches, and extended-release formulations. Clonidine's mechanism of action makes it a valuable treatment option for patients with specific medical needs. Clonidine is available in various forms, including tablets, patches, and extended-release formulations. What are the benefits and uses of Clonidine? Clonidine effectively controls, but does not cure, chronic conditions like high blood pressure and ADHD, requiring consistent use as directed by a healthcare professional. Conditions Clonidine treats: high blood pressure, hypertension, used alone or with other medications to lower blood pressure, reducing the risk of strokes, heart attacks, and kidney problems. Attention deficit hyperactivity disorder, ADHD, for children aged 6 years and older, it helps manage symptoms like difficulty focusing and impulsivity as part of a comprehensive treatment program. Secondary uses of Clonidine. Clonidine also treats a variety of other conditions due to its broad pharmacological utility. Menopausal hot flashes and flushing. Drug withdrawal symptoms, alcohol, opiate. Diarrhea. Spasticity. Certain pain conditions, including severe cancer pain. Dysmenorrhea, painful menstrual cramps. Hypertensive crisis, medical emergency with very high blood pressure. Adjunctive therapy and smoking cessation. Diagnosis of pheochromocytoma. The diverse uses are rooted in the Clonidine mechanism of action, stimulating alpha-2 adrenoreceptors in the brainstem to reduce sympathetic outflow. How does Clonidine work? The primary Clonidine mechanism of action involves stimulating alpha-2 adrenoreceptors in the brainstem, which significantly reduces sympathetic outflow from the central nervous system. This essentially calms down signals from the brain that would typically increase body activity. This reduction in sympathetic activity leads to decreases in peripheral resistance, easier blood flow. Decreases in renal vascular resistance, improved kidney blood flow. Decreases in heart rate. Decreases in blood pressure. Clonidine also reduces noradrenaline release and influences pain systems. While it can initially cause a short-lived increase in blood pressure due to peripheral effects, this is followed by a more prolonged and dominant decrease in heart rate and blood pressure due to its central action. Clonidine dosage. The Clonidine dose is highly individualized based on the condition and formulation, oral tablets, extended release, or Clonidine patch. General dosage information. Dose varies by patient, condition, and medication form. Follow doctor's advice meticulously for safety and effectiveness. Typical dosage instructions, as per doctor's advice. Oral administration, general, typically twice daily, often with a larger portion at bedtime. Take at the same time daily for consistency. For hypertension, adults, oral. Initial, 0.1 mg twice daily. Adjust weekly by 0.1 mg/day. Maintenance, 0.2 mg to 0.6 mg per day, divided. Maximum, 2.4 mg per day. For hypertension, adults, transdermal patches. Initial, 0.1 mg/24 hours Clonidine patch every 7 days. Adjust by adding patches or switching to larger systems if needed. Maximum, 20.3 mg/24 hours patches every 7 days. Apply to hairless skin, new site each time. Effect may take 2 to 3 days to begin when switching from oral. For attention deficit disorder, pediatric, CAPVE, extended release tablets. Age 6 plus, initial 0.1 mg orally at bedtime. Increase by 0.1 mg/day weekly. Maximum, 0.4 mg/day in 2 divided doses. Swallow whole, do not crush/chew/break. Taper dose by 0.1 mg every 3 to 7 days upon discontinuation. For attention deficit disorder, pediatric, Onida XR extended release oral suspension. Age 6 plus, initial 0.1 mg orally once daily at bedtime. Increase by 0.1 mg/day weekly. Maximum, 0.4 mg once daily at bedtime. Do not substitute for other Clonidine products on a mg per mg basis. Taper dose by 0.1 mg every 3 to 7 days upon discontinuation. Full therapeutic benefit may take 2 to 4 weeks. What should I do if I miss a dose of Clonidine? Take as soon as remembered. If close to next dose, skip the missed dose. Do not double. Contact doctor immediately if 2 or more consecutive doses are missed. Abrupt discontinuation can cause severe rebound hypertension, a potentially fatal condition, due to the Clonidine mechanism of action on the sympathetic nervous system. What happens if an overdose? An overdose can be dangerous and requires immediate medical attention. Symptoms of overdose: severe dizziness or drowsiness, fainting, slow/irregular heartbeat, slow/shallow breathing, seizures. Other symptoms: feeling cold, irritability, weakness, lightheadedness, weak reflexes, pinpoint pupils. What to avoid? Alcohol can intensify dizziness and drowsiness. Driving and hazardous activities, avoid until effects are known, due to dizziness or drowsiness. Overheating and dehydration, avoid during exercise or in hot weather. What are the side effects of Clonidine? Clonidine side effects range from common to serious, with some appearing rapidly and others developing over time. Common side effects: dry mouth, most common, up to 50%. Drowsiness/sedation. Dizziness. Constipation. Headache. Nervousness. Nausea and vomiting. Tiredness/fatigue. Weakness. Rash and hives. Sleep problems, insomnia, nightmares. Irritability. Loss of appetite. Swelling of the feet and lower legs. Serious but rare side effects: cardiovascular problems, fainting, very slow or irregular heartbeat, bradycardia, severe chest pain, shortness of breath, heart block, congestive heart failure, heart palpitations. Mental/mood changes, mental depression, hallucinations, confusion. Allergic reactions, hives, difficulty breathing, swelling of face/lips/tongue/throat, hoarseness. Withdrawal symptoms: if stopped suddenly, rapid rise in blood pressure, rebound hypertension, fast heartbeat, nervousness, anxiety, headache, nausea, flushing, lightheadedness, chest tightness, uncontrollable shaking. Can be life-threatening. Serious gastrointestinal problems, e.g., GI block, ileus. Advise users to consult a doctor if any symptoms worsen. Inform doctor if common side effects persist or worsen. Seek immediate medical attention for any serious side effects. Why is Clonidine bad for certain individuals? Why is Clonidine bad for certain individuals is due to contraindications and potential to worsen pre-existing conditions. Contraindications: known allergies to Clonidine or its components. For Clonidine patch or injection, avoid with active infection at site, bleeding disorders, or if taking anticoagulants. Worsening pre-existing conditions. Can worsen heart/cerebrovascular problems, heart attack, stroke, heart failure, heart block, low blood pressure, orthostatic hypotension, Raynaud's syndrome, and depression. Withdrawal risk: abrupt discontinuation is dangerous, leading to severe rebound hypertension. Overdose risk: excessive amounts can cause severe low blood pressure, heart rate abnormalities, breathing difficulties, seizures, and coma. Age sensitivity: older adults, 65 plus, are more sensitive to dizziness/drowsiness, increasing fall risk. Lower doses often recommended. Pregnancy and breastfeeding: use only if clearly necessary, passes to placenta and breast milk. Kidney dysfunction: impaired kidney function slows elimination, increasing side effect risk. Surgery: generally avoid several hours before and after surgery due to effects on heart and blood pressure. Precautions and warnings. Clonidine requires careful adherence to precautions due to its impact on physiological systems and interactions. Who should avoid this medicine? Individuals with known allergies to clonidine or its components. For clonidine patch or injection forms, avoid with active infection at the site, bleeding disorders, or if taking anticoagulants. Conditions where caution is needed. Cardiovascular conditions: history of heart rhythm problems, stroke, low blood pressure, orthostatic hypotension, heart attack, coronary artery disease, or heart failure. Kidney disease: impaired function increases risk of drug accumulation. Neurological/psychiatric conditions can worsen existing depression. Other conditions: pheochromocytoma, Raynaud's syndrome, contact lens wearers, can cause dry eyes. Before surgery, inform doctor/dentist about all medications. Generally avoid several hours before and after surgery. Risk of dehydration/overheating, avoid during physical activity and in hot weather. Abrupt discontinuation: do not stop suddenly due to severe rebound hypertension. Are there any age restrictions for using clonidine? Children, only clonidine extended-release tablets, Cap-A, Onida XR, are FDA approved for ADHD in children 6 years and older. Close monitoring for side effects is needed. Older adults, 65 plus, more sensitive to dizziness/drowsiness, increasing fall risk. Lower doses and close monitoring are recommended due to reduced kidney function. Pregnancy: use only if clearly necessary, high drug levels in placenta and amniotic fluid. Breastfeeding: passes into breast milk, consult doctor. Alcohol or food interactions. Alcohol interactions: limit or avoid alcohol, it intensifies dizziness and drowsiness, and can lead to dangerous drops in blood pressure, increased risk of strokes, heart attacks, confusion, and breathing difficulty. Food interactions: no specific foods to avoid. A healthy, balanced diet is beneficial, especially for high blood pressure. Avoid known triggers for migraines or hot flashes. Possible interactions with other medications. Drug interactions. Clonidine can interact significantly with other medications, especially those affecting the central nervous system or cardiovascular function. It is crucial to inform healthcare providers about all medications, supplements, and herbal products. Clonidine is a depressant, slowing the nervous system and affecting heart function. Overview of how this medicine may interact with other drugs. CNS depressants: exacerbates depressant effects, sedation, drowsiness, slowed heart rate/breathing. Examples: antihistamines, sleep/anxiety medications, muscle relaxants, opioid pain relievers. Other blood pressure medications: adds to hypotensive effects, potentially causing excessive blood pressure drops. Beta blockers: serious interaction, both slow heart rate. Increases risk of severe withdrawal symptoms, rebound hypertension, if clonidine is stopped suddenly. Calcium channel blockers: potential for serious heart problems when combined. Drugs affecting heart rhythm and conductivity can lead to serious cardiac issues. Certain antidepressants may interact with clonidine. Possible impact when combined with supplements, herbal products. Inform doctor about all products, especially before surgery. Avoid medicines and supplements known to cause drowsiness, as they can worsen clonidine's sedative effects. How should clonidine be stored? Clonidine should be stored properly to maintain its effectiveness and safety throughout its shelf life. Keep it in its original container, away from children and pets. Recommended storage temperature for clonidine. Store at room temperature, ideally between 15 to 30 degrees Celsius, 59 to 86 degrees Fahrenheit. What happens if clonidine is not stored properly? Exposure to excessive heat, air, direct light, or moisture can degrade active ingredients, reducing efficacy and potentially affecting safety. Keep away from children, sunlight, or moisture. Keep in a cool, dry place, protected from heat and direct light. Store securely out of reach and sight of children and pets. Dispose of unused or expired clonidine properly, preferably via a drug take-back program. Fold patches sticky side together.